So I'm going to be speaking about exercise and the ramifications of exercise and arthritis. So first of all, I'd like to define for you what is physical activity and what is exercise. So physical activity is defined as body movement produced by contractions of your muscles that increases the amount of energy you use beyond a resting level. Exercise is the physical activity that is planned, structured, repetitive, and purposeful. Exercise's main objective is to improve or maintain one or more of the components of physical fitness. So as you're probably all aware, there are a lot of benefits associated with physical activity. You can improve your physical fitness, you can improve your mobility, you can also reduce your risk of cardiovascular disease, stroke, hypertension, diabetes, osteoporosis, and obesity. And it's also been known to improve mood disorders. It can also decrease the likelihood of falls. With any kind of activity, there's some risk involved, but generally the risk of physical activity outweigh the benefits of physical activity outweigh the risks. The most common would be a musculoskeletal injury. This is something like you can turn your ankle when you're playing soccer, or you could pull a muscle when you're lifting a weight that's a bit too heavy. The less common but more serious types of risk could include things like developing an irregular heartbeat, cardiac arrest or myocardial infarction. Because risks exist when you do exercise, you should probably start by checking with your family doctor and make sure you're safe before you start these activities. Or if you've done activities before but you've stopped it for a period of time, and again, it's probably wise to go and check with them again. What are the components of physical fitness? Well, there's aerobic exercise, muscle strengthening, flexibility or range of motion exercises, and balance exercises. Let's talk about aerobic fitness. We'll define this as the use of large muscles such as your glutes, your quads, your hamstrings for exercise, and this exercise is sustained for a minimum of 10 minutes. In fact, the American Heart Association and the American College of Sports Medicine suggest that you need 30 minutes of continuous activity at a moderate level for this to be effective, and this should be done about 5 times a week. So how do we determine what's moderate, what's intense? Well, what we can do is we can use what is called the relative scale of required effort. And this means using a scale between 0 and 10. And we'll define 0 as the amount of energy that you're using or the effort that you're using just sitting here, resting. 10 is the maximal effort that you can put out. So moderate would be a level at around 5 or 6. More vigorous activity would be 7 or 8. With arthritis, there's evidence to suggest that it's the volume of exercise that's important for getting benefits. So people with arthritis may not be able to do 30 minutes continuous activity, but what you can do is you break it down into 3 groups of 10-minute activity. You start slowly and progress slowly, and you incorporate a warm-up. And when I say incorporate a warm-up, you do the activity that you're going to do, but you use it at a level of a 2 or 3. You also want to protect your joints, particularly if you have a lower extremity type of arthritis, like hip, knee, ankle, foot arthritis. You want to do your activities on a level surface. You want to wear good footwear that's cushioned and supportive. You want to avoid planting and twisting motions. You can also, as Dr. McMahon indicated earlier, you can use unloader bracing. These are braces that are generally custom made, and they shift weight from the bad part of the knee onto the good part of the knee, so it changes the angle of your knee. But these, you have to select your patients very carefully for them to work. The other downside is actually quite expensive to get. Typically, you want to pay attention to your pain. Avoid or change activity that you find is painful. And typically, when you do exercise, you can expect some discomfort, but a good rule of thumb is you don't want to have pain or discomfort more than 20 minutes, 15 minutes after you've done an exercise. If you do have it for longer than that, you're probably doing too much and you need to scale it back down. The next component is muscle strengthening. This can be accomplished a number of ways. You can do weight training. That means you're going to a gym or at home and lifting actual weights. You can use body resistance, so you can do exercise doing like squats to use your own body weight to help strengthen. And you can also use resistive elastics like a TheraBand or bicycle inner tubes or nylon stockings. These should be done 2 to 3 times a week, but generally not on consecutive days, because if you do a hard strengthening exercise program, you can get some micro damage and you need some time to recover from that. Well, how do we progress resistance? Well, let's determine what a starting point is. Starting point is you use a resistance or weight that allows you to do up to 8 repetitions of that exercise, and the 9th and 10th would be difficult to do, so that's where you would stop. You would continue doing these exercises until you can comfortably do 10 to 15. Once you're able to do that level, you can increase the resistance or increase the weight so it's back down to that level of doing 8 before you need to stop. With arthritis, if you have arthritis, particularly in the lower extremity, you want to avoid exercises that are weight-bearing. So you do exercises which are known as open kinetic chain exercises or non-weight-bearing exercises. A good example is if you want to strengthen your quadriceps muscle, one of the things you can do is you can do mini squats in 2 legs or single legs, or if you're familiar with the gym, you can do leg press type of exercises in which you push out against a platform. The problem with these is this also causes compression between your femur and your tibia. So if you have arthritis there, it could be quite aggravating. You could do strengthening for the quads in open kinetic chain or non-weight bearing. So if you're sitting there, you can put an ankle weight on, and what you do is just straighten your legs, so it gets the same muscles, but it doesn't get the compression. Or at the gym, it would be the leg extension machine. This is the machine in which you're sitting in, and you have a resistance bar across your shin, and you straighten your leg out against the resistance. You also may have to start with no weight and just use the weight of your limb. And this is particularly useful for people who have significant arthritis or are quite deconditioned. Using your limb against gravity can be a good starting point. If you struggle with that, what you can do is you can also shorten the lever arms. Say, for example, if you're doing exercise raising your arm, if that's too heavy, what you can do is you bend your arm and then start raising it. By shortening the lever, it makes it easier, and you can work on that until you're able to do a straight arm. Flexibility and range of motion. Well, flexibility refers to the mobility of the muscles, and range of motion refers to the mobility of your joint. There's really actually not a lot of research on how flexibility and range of motion impacts health, but we do know that functionally, if you had a stiff shoulder or an injury to your shoulder, if you can't reach up, it's functionally quite impairing you. It's difficult to put your jacket on, it's hard to put a sweater on, you can't reach the second shelf. So range of motion is important. Now, flexibility exercises, these can be performed a couple times, 3 times a week. And typically stretching is most effective if the muscle's warmed up. So after you've done your aerobic exercise or your strength training, that's a good time to do your stretching exercises. Now, stretching should never be bounced into. It always should be eased into. If you bounce into it, you risk tearing a muscle. Once you feel that stretching sensation, you should hold that for a true 30-second count. So you're going to count 1, 1,000, 2, 1,000, and so forth to 30. And you repeat these 2 or 3 times in a row. And these type of exercises can be done 2 or 3 times a week. Joint range of motion refers to that motion that the joint normally has. And you could take your joint through a range of motion 10 repetitions in a row, take a short rest, repeat 2 or 3 times. And these exercises are generally quite simple and safe, and they can be done on a daily basis. However, you also want to consider the arthritis. As Dr. McMahon indicated, with osteoarthritis, the wear and tear arthritis, one of the consequences is you end up losing range of motion. So it is very important to try to maintain your range of motion. But there are also times in which you have what is called flare-ups. And flare-ups are these times in which the joint is very painful, it's swollen and red. During these times, it's probably wise to stop the range of motion exercise, particularly with joints in the finger with rheumatoid arthritis. When you have a flare-up, the joint can get actually quite swollen. Now, the fluid can't escape, and so what it does is it distends the joint. And if that stays swollen for a period of time, this can actually stretch out the structures that stabilize the joint. If you do range of motion while it's flared up, you can actually stretch these structures more, and when the swelling comes down, the ligaments can be loose, and you can end up with some joint instability or even joint deformities. But once it settles down, then it's, again, safe to do the exercises. Now, as we mature, one of the things that can happen is we lose our balance. And balance exercises can improve your stability, which can help prevent falls in the future. And there's a number of free falls prevention classes that involve group participation. And in the Markham area, if you Google centralhelpline.ca, it can give you a list of where you can go to get some help for these balance exercises. Now, you can have structured and sort of informal type of exercises. And one of the ones that's very helpful are doing exercises which are known as Tai Chi. These types of exercises use slow, controlled, and very graceful type of motions in a weight-bearing position. This can involve shifting weight from side to side and very helpful for improving your stability. Now, these are also done at different levels. Some of them are done upright, some of them are done in a squat type position. So it uses your body weight to help strengthen your legs. And because it is weight bearing, it's also very helpful for helping people maintain their bone density. Now, there's also formalized type of exercise programs. And there's one that's known as the GLAD program. And what that stands for is Good Living with Arthritis in Denmark. And the reason it's called that is because these are researchers from Denmark that did a study looking at specific education and exercises for hip and knee arthritis. And they were found to help improve pain and increase function. And this consists of a series of education classes and 12 exercise sessions done over a 6-week period of time. Unfortunately, there is probably a fee associated with this, and these fees vary depending on how much subsidy they get. But it has been known to improve strength or decrease pain and improve function. Okay. Now, I think in our handouts that were given out, there's a series of range of motion exercises, and I'd just like to review a few of these with you. You can feel free to participate, get you moving around a little bit. We'll start off with the hand. So at the hand, fingers will flex and extend, so making a fist, opening and closing it. Fingers also spread, abduction and adduction, so you can do these kind of motions. They also oppose, so you want to touch your tips to each of the fingers, and also you can reach down low, so it helps maintain the range of motion there. At the wrist, the main movements are wrist extension, wrist up, wrist down, pretty simple. At the elbow, similar. You can straighten out your elbow, bend your elbow. Also, what can occur there is what's called forearm pronation and supination. So supination is when you turn your palm up and your palm down. So these occur also at the elbow. At the shoulder area, you can get elevation in the flexion plane, elevation in the abduction plane. You can also have rotations at the shoulder. So you can achieve these by doing a hand behind back movement. So it's a combined movement, reaching up this way for internal rotation and reaching behind your neck for external rotation. At the foot and ankle, the movements that typically occur there are things such as dorsiflexion, which is raising your foot up, and plantar flexion downwards. You can invert and evert, which is side-to-side movements, and you can make circle type of movements, and these get the range of motion of the foot and ankle. Knees a little bit more straightforward. It straightens out or bends, so these are the movements you can do. You can do this in sitting. You can also do it lying down, sliding your heel towards your rear end. So you just ease into it, okay? But it does help maintain your range of motion. So that basically concludes my talk, and if there's questions later, we'll try to address them afterwards.